Wisdom tooth removal home care. Immediately following surgery. The gauze pad placed over the surgical area should be kept in place for about 30 minutes post-surgery. After this time, the gauze pad should be removed and discarded. Gauze is usually required on and off for about 24 hours post-operatively, should bleeding occur. It is completely normal to have some oozing for the first 24 hours. Pressure is usually all that is necessary to stop intraoral bleeding. Vigorous mouth rinsing and/or touching the wound area following surgery should be avoided. This may initiate bleeding by causing the blood clot that is formed to become dislodged. Please avoid pulling on your cheek to look at the holes. Take the prescribed pain medications prior to the local anesthetic wearing out and beginning to feel discomfort. Restrict your activities the day of surgery and resume normal activity when you feel comfortable. Place ice packs to the side of your face where the surgery was performed. No smoking, tobacco or other products, or vaping for 2 weeks post-operatively. Bleeding. A certain amount of bleeding is to be expected following surgery. Slight bleeding, oozing, or redness in the saliva is not uncommon for 24 to 48 hours after surgery. Very rarely is there significant bleeding with wisdom tooth surgery. Most bleeding may be controlled by rinsing gently to remove old clots from your mouth. Then, placing a gauze pad over the area and biting firmly for 30 minutes. Watch the clock. If bleeding continues, bite on a slightly moistened black tea bag for 30 minutes. The tannic acid in the black tea helps to form a clot by contracting bleeding vessels. To minimize further bleeding, sit upright. Do not become excited and avoid agitation, as this increases your blood pressure and subsequently increases bleeding. Sutures. Sutures are placed in the area of surgery to minimize post-operative bleeding and to help healing. Sometimes they become dislodged, sometimes as quickly as 24 hours post-operatively. This is no cause for alarm. They are self-dissolving unless you are told otherwise. Swelling. Swelling around the mouth, cheeks, eyes, and sides of the face is not uncommon. The swelling will not become apparent until the day following surgery and will not reach its maximum until 2 to 3 days post-operatively. However, the swelling may be minimized by the immediate use of ice packs. 2 baggies filled with ice or frozen peas should be applied to the sides of the face where the surgery was performed. The ice pack should be left on at 20 minutes on-off intervals while you are awake. After 36 hours, ice has no beneficial effect. If swelling or jaw stiffness has persisted for several days, there is no cause for alarm. 36 hours following surgery, the application of moist heat to the sides of the face is beneficial in reducing the stiffness associated with surgery. Pain. Specific medication instructions will be provided during discharge teaching. Prescribed pain medication should be alternated in specific intervals for best results. Do not take any of the above medication if you are allergic to them or have been instructed by your doctor not to take it. If you are planning to continue breastfeeding post-surgery, you must pump and discard your first expression post-surgery. Please alert your pharmacist that you are currently breastfeeding. Caution. If you suddenly sit up or stand from a lying position, you may become dizzy. If you are lying down following surgery, make sure you sit up for 1 minute before standing. Eating. First 24 hours. Adequate nutrition is essential for normal healing. Avoid peroxide, alcohol, carbonated beverages, and drinking through a straw. After 24 hours. You may have soft foods such as cooked vegetables, fish, pasta, and meatloaf, which are easily chewed. Please make sure to avoid seeds or anything small that could get stuck in the extraction site. Hygiene. No rinsing of any kind should be performed until 24 hours after surgery. 48 hours after surgery, you should begin irrigating the sockets with the syringe provided at least 5 to 6 times a day, especially after eating, with a half teaspoon of salt mixed into 1 cup of warm water. There will be a prescription mouth rinse given to you after surgery. Take it as prescribed. Brush your teeth gently starting the day after surgery, taking care to avoid the surgical sites. Note: a bad smell can be normal after tooth extraction if not associated with other symptoms. Discoloration. In some cases, discoloration of the skin follows swelling. The development of black, blue, green, or yellow bruising is a normal post-operative occurrence, which may occur 2 to 3 days post-operatively. Moist heat applied to the area may speed up the removal of the discoloration. Antibiotics. It is rare that antibiotics are prescribed after routine wisdom tooth surgery and show no benefit according to the most recent literature. Discontinue antibiotic use in the event of a rash or any unfavorable reaction. Contact our office immediately. Nausea and vomiting. In the event of nausea and/or vomiting following surgery, do not take anything by mouth for at least an hour. You should slowly sip on some water over a 15-minute period. Alternatively, if you are having no relief, you may go to your local pharmacy and ask the pharmacist for Gravol suppositories. When the nausea subsides, you can begin taking solid foods. If numbness of the lip, chin, or tongue occurs, there is no cause for alarm. If your post-operative pain or swelling worsens after day 3 or unusual symptoms occur, call Apex Surgical for instructions, 250-371-7076. Your case is unique. No two mouths are alike. Remember, we are here for you should you require our help. We wish you a speedy recovery and quick healing.